Going to speak with Dr. Trevor Dixon right now, the founder and CEO of Jaja Foundation.
Yes.
And he's going to be joining Steve Nardozi in the discussion. Dr. Dixon, how are you?
I'm fine, thank you, Dervan. Thanks for having us here. Thanks to Power 106 for having us here to tell the story and the journey of the Jaja Foundation.
And good afternoon. Good to see you again.
Yes, sir. Very good to be here. Thank you.
Okay. I think Dr. Dixon was ready to go.
Yes, I'm more or less ready to go. We're speaking about the EMS situation in Jamaica. As Katisha Dillon, the paramedic from New York City, just explained that we have an issue here with emergency medical services. It's not an emergency service by any means. It doesn't move, as far as we're concerned, as rapid as it should, and the main reason for that is that we didn't have enough transport vehicles, or whatever it's vehicles and personnel, to move patients to the hospital in a timely manner. Every health fair we go to, we find instances where people need immediate medical care, and it's compromised because we have to wait to see how soon we can have an emergency medical vehicle to transport these patients there. And it really brings tears to our heart. Currently we have an ambulance that's been brought into the country, and we're waiting for clearance of that ambulance. And we're told we have to pay $20,000 to clear this ambulance to work in the public sector. And when I say the public sector, I mean the public sector. We're not for profit. It's a public vehicle. Yes, there are a lot of partners who want to see this happen. The Negril Chamber of Commerce, Jamaica Fire Brigade, and of course the Jaja Foundation. We want to see this for the people of Jamaica. And because we can't get the proper waiver, it's unreasonable for me to pay $20,000 to clear
US dollars.
US dollars for an ambulance that costs $38,000. It's just unreasonable. And why is that unreasonable? Because if we had been given a waiver for this public ambulance, we can buy 2 more ambulances and get them on the road here in Jamaica. Because everyone you talk to says they don't have any vehicle. Sometimes the vehicles are in disrepair, or sometimes the vehicle has to go to another area to serve that community because we just don't have enough ambulances on the island. And we understand that. And our fine government always talk about public-private partnership. There's no better example of public-private partnership than when you're trying to save someone's life. That's the ultimate need of public-private partnership, is to save lives. If we're not saving lives, and if saving lives is not a priority, I don't know what we're about. So those who are listening, who knows those in government who can assist us with this journey. I know sometimes the assistance doesn't come because they don't understand what we're doing. But if they can sit at the table with us and understand that this is not a private venture. This is a public venture to work with the Fire Brigade, as I said, and Jamaica's public system. We're still here training people to be first responders because we're bringing in the proper training. They're CPR trained, they're BLS trained, and they're trained to respond and safely transport patients to the hospital. Right now, I have to leave. Why do I have to leave? Because there's a patient that's at the health fair who has some serious, looks like cardiac issues. And because of the fact that there's no ambulance, I told my team, call 119. Because that's the system we have in place. We have to give a chance the system in place, because I know what they're going to say. Did you call 119? And we're going to go through the system and see how long it takes for an ambulance to respond. And I'd love to stay on this interview, but I have to go now. My team members say the best ethical decision to do is to transport this patient to the hospital myself. So I have to leave this interview and transport this patient. But we need people who have cooler head to understand this is a serious issue. We in the States, we know better. So we have to do better. So I hope Steve Nardo and the rest of the team can finish this interview while I transport this patient to Savlamar Hospital at this time. And that's just the honest truth. Okay.
All right, Dr. Trevor Dixon. Steve Nardosi, what are your thoughts on what you have heard so far?
It's a system problem, and EMS is supposed to be a system, and the system is supposed to work. But sometimes, no matter how many EMTs we have trained, the system is flawed. and volunteer
I called
personnel to
119.
help.
I
The
spoke to
people
the operator.
of Jaja
She said that they have
Foundation
no
are local partners.
ambulance. I should get a taxi
the
or a
members of
vehicle
the
and put
community
it
that are being trained
And I said, is there any other option?
want
Because we need
to
this.
help their community.
I told her the
and we,
urgency of
Jaja
the
Foundation,
matter.
is supplying
But
an
she's in dire
ambulance.
need. I
But
think that's about ASAP.
The
She said,
system needs
she
to
can
work.
give
It's
me
not
this
one
number.
person.
So
It's not 10 people. It's a
You
system.
can talk.
For the last
The first
2
patient
days,
from the
we've
Ulster
done,
Spring,
you know,
Mr.
9
Williams
to
just called
5
me.
training,
They just pulled 500 cc's
where
of
we
fluid
have
off her heart. She's
newer
now at
members
Cornwall Regional
of
Hospital.
GEMS, Jaja's, Jamaican EMS.
500
cc's, yeah.
Update, sorry. Excuse me, Steve.
No, and it complements what Mr. Nardozi has been talking about. The patient that Dr. Dixon just spoke about. So the update from the 119 call is that the patient should be put in a taxi and brought to the hospital.
Okay.
Now that's unacceptable,
Oh, dear.
right? So the person who made the call asked what other options there are, and they were given a number to call a private ambulance. Now patients in rural communities don't have the money.
That's right.
Right? So I said it when you interviewed me the first time. Healthcare is a right. It's not a privilege. And it's very upsetting, it's very frustrating because we know that we can do better. The patient from Ulster Spring who we had to transport to Falmouth Hospital in a private vehicle. We just got an update. They pulled 500 cc's of fluid from around that patient's heart. Now she's in ICU at Cornwall Regional. And I'm very passionate. I'm upset. And I don't even live here. Because I know that we can do better. We can do better. Right? And this is why until Jaja no longer needs me, I will do all I can because the system can change and it must change.
Just about getting ready to wrap today's special edition of your program, Both Sides of the Story, Power 106 FM. I'm Dervan Malcolm, and we've been spending the afternoon here at Little London Methodist Church in Little London, Westmoreland, and it's all a part of celebrating the work of Jaja Foundation and their team of volunteers as they continue to play their part. And here's another example of how the level of commitment that the members of the organization engaged in. It's quite evident. Dr. Dixon has had a very hectic day and still managed to get back to us before we wrap the program, which is in another 3.5 minutes or so. Dr. Dixon.
Yeah, I just want to thank you and the listeners of Power 106 for their support over the years. I want to thank all the volunteers. We have a lot of volunteers. Some of the volunteers are here. Some of them couldn't make it this year, and some of them are supporters and our sponsors. And I just want to thank everyone. And I just want to highlight that when we spend so much energy trying to do something that is needed and it's quite obvious to us all, it just means that other areas we can improve in, that suffers, that becomes more of a deficiency. There's a lot of issues here, and if we could just cross this hurdle, you know, and we speak about the ministry, we speak about partnership. I mean, there are people in the ministry who are trying to make this happen. Mr. Courtney Cephas, he is trying to help, to help us. Mr. Courtney Cephas, I want to give a shout out to him. But it seems that it's just an issue where people can't wrap their head about what we're doing. This has never happened in Jamaica before, where a volunteer NGO wants to start a volunteer EMS system within a community. So I understand it's new and it's different, but the definition of insanity is to keep doing things the same way and to expect a different result. So we at the Jaja Foundation, we're trying something different. No, we don't just want to give an ambulance to the ministry, because we understand that the constraint of the ministry working, they have to bring an ambulance to another area when another area is deficient. We want this community to have a stable EMS system, and if this is successful, we can reproduce this anywhere in the island. And there are other organizations who will be willing to follow our blueprint and reproduce this throughout the island. So if the government is serious, then give us this waiver. And we don't just want this waiver for one-time waiver, because it's a system. Our intention is to bring 5, 6, 10 ambulances in the country and distribute them to the different fire brigades so we can work together. The community can work together with the ambulance system. So we can talk more about this. They know where to find me, the foundation. Thank everyone for the support, and thank Power 106. This is an ongoing conversation. It's certainly not going to end here today.
Definitely not. Thank you so much. Well done. We salute and celebrate you and your team, Dr. Dixon, and wish you all the success that life has to offer. Take care.
As I say, one love, Jada Foundation every time.
All right. That's it. Thanks, everybody. All that's left for us to do is to say thank you very much for making it both sides of the story, Power 106 FM. All things being well, both sides of the story returns Monday afternoon, 2 to 5. In the meantime, we'll catch you tomorrow morning somewhere. Well, you have to listen to find out. Take care, everybody.